So Stephanie, please, the floor is yours.
My name is Stefanie. I work in Berlin. And the first thing you'll see is the Frick test, which Dr. Nasr already talked about. It's for the symptomatic dermographism. And as she already said, it has 4 pins that the doctor will scrape on your upper or lower arm. And it'll produce these lines that are red. Before that, you will, of course, be talked to about the diagnostic, and yeah, you'll be instructed to just keep your arm still and wait for the signs to come. We're going to wait about 10 minutes after the scraping to see if anything forms on your arm. And if so, well, it's kind of clear that the symptomatic dermographism is there. Next, we have the solar urticaria. We have this light utility that we can put on your arm. It will involve having you wear a UV glass so that you cannot see the UV light, which is harmful to your eyes. So before that, you'll put on the glasses and you just wait for the physician or the nurse to do the procedure on you. The thing itself would take a couple more minutes because it'll need to warm up for like 4 minutes, but then the procedure itself will be super short. It'll be about 47 to 107 seconds only, depending on your type of skin and the area where the procedure is going to be used on. It is most likely going to be your arm, but mostly on the inside where the sun is not hitting as much, or maybe also your buttocks. And we've got the cholinergic urticaria, which is sort of the thing I am actually doing most often because we've got lots of patients who are also taking part in studies where they have cholinergic urticaria. We do this exertion test, which is probably very known to you because it's just going and driving a bike. You're gonna do it for half an hour unless you have symptoms or major symptoms. Way before that, we may stop the test in between, just so you don't have to exert yourself and be overly provocated. It is going to be very slow at the beginning. You're gonna have to have a pulse of about 70. So you're gonna drive very slowly and just get used to being on the bike and being calm. And we're gonna put up the speed. Every minute you're gonna have a pulse of 3 beats a minute more than before. So in the end, after 30 minutes, you're going to have a pulse, or should have, of about 160 beats per minute. And if we see symptoms, of course, we're going to already document that. Now we've got the cold urticaria test, which Dr. Nasr already talked about. We have this temp test, which we use on our patients. It is going to heat up first or cool down as well, because the test itself has this spiral that you're going to see. It starts with 4 degrees Celsius and ends up with 44 degrees. And if you do have cold urticaria, you're going to have this sign or wheel on your forearm. We're going to measure the temperature up until the wheel is appearing, so that we can know what kind of degree sort of we're talking about. And if you have it like in a mild way or also in a major way. Don't have anything for chronic spontaneous urticaria. Before you take any test, the doctor, the physician, is going to talk to you about that and what risks there are. But way before you go to the doctor, it's needed that you stop taking your antihistamines 3 full days prior to the test, so that it's not that your body is not protecting itself. It's also super important that you try to avoid any triggers before testing. So, for example, if you do have or probably have the cholinergic urticaria, you might not want to ride your bike to the test, but instead maybe use the car or the bus or anything that doesn't trigger your urticaria. It's good to know and, helpful to realize that there's always emergency kits available in case you need anything, in case there's something major going on. If you have major symptoms, we do have EpiPens, and there's always a doctor inside, so you don't need to worry. Of course, we also take photos to document all the results for future therapies, for your progress, for diagnosing. If you take part in studies, we need to document super well, so everything's, up to par. And after the provocation tests, of course, you can take your antihistamines if you need them. You may want to take a shower afterwards if you rode the bike. Anything to help you calm down and take your symptoms away.